there can be factors that are out of our control
Right.
where we might be activated all the time, or we might be facing any number of challenges that, can make life harder, but also make it harder for us to cope. And we recognize that that's okay. It's not, um, again, adversity is not destiny, but we can recognize that the hard things are hard, but we can also see what else is true. Alongside the hard things, we might have other support networks or community members or families, or just some strengths within ourselves that we can go back to help provide that lens for us to be able to get through.
Hello, I'm Tony,
And I'm Casey.
and welcome to Anthony's Way, the Road to Kindness, and our YouTube podcast channel, The Way Forward, a Kindness Mission. And we want to welcome especially those joining us for the first time. It's great to have you with us. We created Anthony's Way, the Road to Kindness, in memory of our dear son, Anthony, with one mission in mind: to help kids with ADHD to thrive. Since we launched in October of 2023, we've been able to help close to 100 families get the right care for their child. What's really exciting now is that we're actually giving grants and sponsorships out to families, and we're helping them to cover the cost of care. So we're so excited about that piece. And now May is Mental Health Awareness Month, and it's an annual observance to highlight the importance of mental well-being, educate the public, reduce the stigma, and promote support for those affected with mental health conditions. Each year, individuals and organizations come together to raise awareness and advocate for better mental health and resources. So this time, it's time for everyone to show their care and to stop, listen, and provide help. And this month, we asked, what can you do, those listening to our podcast, to do differently to support those with mental health struggles? Together, let's raise awareness and let's always be kind. So we're excited to have with us today J'vanete Skiba, who's joining us, and we're great to have you.
Thank you for having me. I appreciate
And
being
we're just
here.
so excited because we know for 2 years we know you.
Yes.
So
Yes.
it's been a fun 2 years. We learned so much from you.
Yes, we've gotten to
And
actually be a part of your process, which has been fantastic for us.
yeah, it's been really cool.
No, it's been so great getting to know you both too. So,
So from a young age, J'vanete dreamed of two seemingly disparate careers, a lawyer and a cheerleader. This unique combination reflects her lifelong passion for advocacy, support, and empowerment. Today, as the director of the New Hanover County Resiliency Task Force, she embodies these aspirations by fostering a more compassionate and resilient community. In her role, J'vanete is dedicated to nurturing strong partnerships with community leaders and organizations. She provides thought leadership and professional development in trauma-informed and resilience-focused practices, aiming to create a culture of support and understanding throughout the community. Her favorite aspect of her work is the opportunity to bring resilience skills to the community, forging connections across various sectors, from educators and first responders to local businesses. J'vanete holds a master's degree in education with a specialization in neuroscience and trauma, along with professional certificates in trauma and resilience. She is a certified community resiliency model trainer, that's a mouthful,
yeah.
and a Reconnect for Resilience educator. Her academic and professional work has emphasized the importance of addressing racial trauma and implementing a trauma-informed approaches that prioritize racial equity. In addition to her current role, J'vanete has a background in advocacy as a voter engagement specialist and has worked in special education as a paraeducator. Her diverse experiences have equipped her with a unique perspective on the challenges faced by individuals and communities, further fueling her commitment to resilience and advocacy. Through her work, J'vanete continues to inspire others, proving that with the right support and resources, communities can thrive and overcome adversity. We have known J'vanete for 2 years, and she has been a blessing for our community in sharing compassion and resiliency training. We have gone through the training, and we are excited for J'vanete to share with you today. J'vanete, we are so excited to have you with us today.
Yeah, thank you. And
I'm
what a
so
privilege.
glad to be here. I truly am.
It's a perfect month to Mental Health Awareness Month, perfect month for resiliency and resiliency training, and to have you to tell the community and our listeners all about what you do and what you bring and the beautiful power of what you bring to the community. So, you know, let's kick it off with this. You have so much to share. So start out by sharing your story, which I thought was really, really neat about, your cheerleading and all your background and just share your story with everybody so they can understand how the depth of the background.
Absolutely. Absolutely. And so I love to share that bio because it really goes to just the skills and abilities that we all have, those things that kind of naturally come up in us. And being an advocate and wanting the best for people and encouraging them towards that is really at the heart of everything that I do.
Yeah.
Um, the work that I get to do right now is very much a gift because it comes from an authentic place.
Mhm.
Um, when I started in education, I started as a media assistant. I worked at a local school site in the library with an excellent media specialist. And not long after that, I found out that I was going to have my daughter. And my daughter happens to have spina bifida.
Mhm.
And in that, I was motivated to stay home with her. So after leaving that post and working at another school as an assistant, I stayed home with my children for 10 years. And
Great.
I think that really shaped how I see trauma and resilience, even though at the time I didn't necessarily have the words for it then. But what I observed in the classroom and what we lived at home uh, was pretty profound. Uh,
Mhm.
and when I went back to the classroom, I went to the special ed classroom as a paraeducator, and I was serving children with diverse needs in the general ed setting and in separate settings. And just recognizing the unique stressors that families have when their children have maybe different needs than typical kids, and watching them navigate typical spaces in school and in the community. So it really helped widen um, that felt sense for me of the need for trauma-informed, resilience-focused practices, even though I didn't have the word for it. I would go back to kindness and compassion
Yeah.
and
Mhm.
spaces that meet the needs of the people that they're serving. And eventually became a member of the task force through learning about that perspective, gaining that knowledge on biologically based wellness skills through the community resiliency model. That was how I got introduced to the work that I do right now and how I started building that knowledge base for all of those things I was recognizing in my home and at work, in the community and at the schools I had been working at.
That's awesome. So how's your daughter doing now?
Great, great. She's 21. She graduated
Oh,
from
God bless.
community college last week, and
Oh,
she's
yeah.
going to transfer to UNCW in the fall. So,
Oh,
Okay.
fantastic. So she'll be nice and close.
Yeah, that's
yes, yes.
Yeah.
good for her. Congratulations.
Thank you. Thank you.
So what is resiliency or what is resilient?
Oh, goodness. I think resilience, often we hear bouncing back after adversity, the ability to manage the stress of daily living is
Yeah.
what I go to. That's a definition that I try to stay with, but also not just surviving those things in life, but actually thriving. In past talks that I've done or panels that I've served on, I've heard specifically bouncing forward that indicator of post-traumatic growth or the capacity that we build after we go through hard things. And I really like that bouncing forward idea too. So I would land with resilience being that ability to thrive and bounce forward after we've gone through stressful events or hardships.
Yeah, I like to call it moving forward.
Hmm.
Yes,
Bouncing
Bouncing
yes.
forward.
forward. Yeah.
I like bouncing forward.
Yeah. I mean,
Don't say moving.
that's what we kind of had to do. It was
Hmm.
go backward or go forward. And, we thankfully chose to go forward. So,
Yeah,
Hmm.
it did. So
yeah.
yeah, I love the call it moving forward. I love that. I love that way you explained that. That was beautiful. Yeah.
I think you all are a great example of that too. Um, just the way you've taken that moving forward or that bouncing forward into what you've done with Anthony's Way. And just, Anthony, when you were saying that you've served almost 100 families, what a great impact.
Yeah, over
Um,
years.
that's to me another example of such deep resilience.
Yeah, yeah, and I'll tell you, every family we talk to, I cry with them. Man,
Hmm.
just
Hmm.
we love helping kids, and so the thrive word is so important.
Hmm.
Resiliency,
Hmm.
helping them to continue to thrive, bounce back, and thriving. That's what we want these
Hmm.
kids to know. So
Yes.
go into some detail about the task force. When was it created? Is it,
Hmm.
what's its total mission? And then do other like this is New Hanover County's task
Hmm.
force for
Hmm.
resiliency. Do other counties have the same task force, or is this new? And just
So, yeah, so I think I'll start with our beginning. Um, there were some community leaders working in various sectors from government to early childhood advocacy to law enforcement and justice and the faith community who were noticing some things that were overlapping across those sectors. Um, and Smart Start of New Hanover County had hosted a first 2000 Days Summit where the film Resilience, the Biology of Stress and the Science of Hope was screened.
yeah,
And from that film, it got wheels turning. And this group of leaders came together and said, I'm noticing this. And coming into our classrooms or with the folks that we're serving, the youth that we're serving in our community, things like third grade reading proficiency or being justice involved or any number of things. And just witnessing that overlap across sectors and what they were finding and the film resonating so deeply,
yeah,
um, going back to adverse childhood experiences as opposed to things, conventional ways of us thinking about some of these issues of it's just behavior or people don't care. It's really the science behind why we're seeing the things that we're seeing. And so this group of people wrote a planning grant to begin the task force, got community buy-in from partners, like as I mentioned, from government to law enforcement and justice to education to come together and build a blueprint for how we were going to create a more resilient community from that knowledge of adverse childhood experiences. And formally in 2018, that's when our Resiliency Task Force, New Hanover County Resiliency Task Force, began. We are not a county entity. Communities and Schools is our fiscal sponsor. The executive director was one of those great minds who saw the need and wanted to help build the ship. And they're our fiscal sponsor, but the Resiliency Task Force is kind of its own entity in the community as far as our mission and our vision. We are bringing our partners together, and to date, we have about 56 organizational partners across sectors who have committed to understanding that adversity is not destiny, that our community can build skills, providers can build skills so that they are not re-traumatizing people that they're serving, and that we can raise awareness around adversity in the community. So our mission has become us working together to prevent and respond to adverse experiences, toxic stress, and trauma. And we say adverse experiences because so much study has come from that original adverse childhood experiences study that has expanded how we think about toxic stress and trauma to include what we call the four realms of ACEs. And so our task force um, works, with that lens of those four realms of ACEs: adverse childhood experiences, adverse community experiences, adverse climate experiences, and atrocial cultural experiences. So we work through all of those contexts. As far as other resiliency task forces, there are lots of resilience collaboratives in North Carolina. I
Okay.
think there might be about 40 at this point, but all of them are different. Most of them come from that adverse childhood experiences as it being their galvanizing um, point, their
Right.
galvanizing issue. But all of the different collaborative resilience collaboratives, whether they are task forces or coalitions or action networks, um, all do work differently, and we're not necessarily affiliated with any of those. But
So,
there's lots of work going on in our state, which is something to be proud of.
yeah.
Yeah.
So, I mean, we before we got here, we were from Pennsylvania. We never
Hmm.
heard of community resilience task force teams, and we
Hmm.
just didn't hear about it. So,
No.
go into more detail about adverse childhood experiences. What drill down on that for everybody a little bit. So, what does it mean? What fits into that category? And then how do you?
So,
Yeah.
yeah, absolutely. Adverse childhood experiences. Um, And Anthony and Casey, what I find so interesting about this, these 10 adverse childhood experiences were actually found by accident.
Oh, okay.
Doctors Anda and Folletti um, created that seminal study that found these 10 adverse childhood experiences to affect health outcomes later in life. um, and these 10 include dysfunction in the household, whether that's having a parent who is incarcerated
Mm,
or a parent who is struggling with substance misuse, or a mother who might have maternal mental health issues. So those are some examples of that household dysfunction within that 10 ACEs. But it also includes things that we would expect, like physical and sexual abuse, physical or emotional neglect. Those are included in those 10 ACEs. And what doctors Anda and Folletti found, again by accident, they were working, one was working in a smoking cessation clinic
mm,
and a weight loss clinic, and the other was with a large healthcare provider. And what they found just through asking certain questions was that these 10 adversities were common amongst the people that they were serving. And so they did a huge epidemiological study with, I think, about 17,000 or more participants. And they found these 10 adversities to correlate with things like COPD later in life, or um, vulnerability to violence or broken bones, even.
mm,
So this study really did change um, how people considered those later in life health issues, and the things that we could possibly do to help prevent or respond to or mitigate the effects of adverse childhood experiences to improve health outcomes later in life.
Okay. Where were the two doctors located at?
In California.
Okay.
Hmm. Hmm.
So out of the four buckets, most of your time is spent on the four realms of adverse childhood experiences. Most of it is in the adverse childhood experience area, or is it? broken.
Childhood and adverse community. We really, actually, really all of them. What we try to do is not necessarily, we go back to adverse childhood experiences being that galvanizing issue, and we do raise awareness around that.
Okay.
And our strategy has really been to support providers across sectors because we know that families coming to seek their services really need to be connected, and we need to improve those help-seeking behaviors across the community. And so we do leverage that. But we also want to bring to mind that these things don't happen in a bubble. Those adverse childhood experiences don't happen in a vacuum. They
Yeah.
are heavily influenced by community experiences and what's happening in our environment, with our climate, and with atrocious cultural experiences, which I consider to be the groundwater that feeds that, what we would call that tree of adversity. So we use that as a lens for our work, so that we are able to strategically kind of hit on all four of those realms in the training that we do and the awareness raising that we do in the community.
Cool. So good.
Well, so we got to know you through through your work with the Harrelson Center,
Yes,
which is a nonprofit in in Wilmington, who is an umbrella nonprofit for how many other nonprofits? Like,
20 on site and then 20 or so
yeah,
off site.
which
So
we're a part of.
yeah.
So, explain the work that you do with the Harrelson Center and all of these nonprofits.
absolutely. So the Harrelson Center is a great example of one of our belief statement signing partners. And when I say belief statement, going back to those items that I mentioned earlier that organizations believe to be true, that adversity is not destiny, that we can develop skills in our community where we are resisting re-traumatization. Harrelson Center is a great example of that. We've been able to partner with Harrelson Center over the last 3 years to deliver what we call leading from abundance.
Yeah.
And that does drive back to what I mentioned before, us really supporting provider resilience.
Mhm.
Um, and in that partnership, the goal is to equip providers, and we know that a lot of the partners at Harrelson Center are our human service partners. They are supporting wellness across the community in various ways, whether it's through supporting foster families or families that might have unique needs, or supporting families who are really vulnerable to being unhoused or homeless populations. So that's just to kind of a tip of the iceberg of everything that's represented in service at the Harrelson Center. But the goal of that series was really just to provide a lens and a common language for providers so that they were pouring into the work that they were doing from abundance and not from scarcity. We know that the nonprofit sector, due to so many different factors and pressures, external pressures like funding, and as an example, are feeling that stretch right now. So to answer that and meet that need, um, we wanted to be able to provide community resiliency model training. And that model has been what we've leveraged strategically across the community to build a language of resilience, to help people start to frame trauma-informed, resilience-focused practices, and to equip our community with evidence-based tools, skills to be able to manage those stresses of daily living, to manage when we have highly stressful events, and to help us be more resilient to trauma. Um, and even though, um, as I mentioned before, ACEs are incredibly common, and trauma is incredibly common. We can still build resilience to them. It doesn't mean that we're not going to, what I always say is walk through that water and not get wet. That's not the point. We just are able to recognize what else is true because we go back to those body-based, evidence-based skills that we've kind of exported into the community. And Harrelson Center and the series Leading from Abundance is an example of how we are exporting that in the community to support provider resilience with the hopes that as those providers go into their spaces, they're better able to support staff and as well as those that they serve and
Yeah.
resist re-traumatizing them because they have that lens, right? That
Mhm.
understanding of trauma and resilience.
Yeah, it's so important. It's what you're doing for the Harrelson Center and the teams are just we've learned so much, about our own, but about ourselves too. I mean, part of this
Mhm.
is knowing how you deal with resilience or how you deal
Exactly.
with challenges, and then how can you give the positivity and the support to the families that you take care of, which is just great.
Mhm.
So, so do organizations reach out to you, or do you have statistics that you track to say this organization seems to really be challenged, and we should go help them? What are the pathways that you go and help organizations
Yes,
you?
we go where we're invited. So a lot of organizations reach out to me directly. And what's great about um, the task force being able to use the community resiliency model, the model was designed by Trauma Resource Institute located in Claremont, California. The key developer, Elaine Miller Karras, wanted to take a model that she had developed called the trauma resiliency model for clinicians and practitioners um, and create a complement to that that communities could use. So just community leaders being equipped with the knowledge and skills to help their communities through hard times. Um, and so when we needed that model during Florence,
Yeah.
that's really what accelerated our use of it. You know, we had a flashbulb um, moment in our community where not long after I joined the task force in 2018, where we saw the real gains of having a model like this. One example, before I joined on staff, an example during that response, we had folks who were not in disaster response. Um, being first responders, like librarians,
Yeah.
receiving helicopters at the government center because they were working that shelter, or principals at school sites that had become shelters receiving people in distress. Um, and so, kind of that flashbulb moment for us is what set the stage for us to be able to use this model effectively. We saw the need. And, as I said, we go where we're invited. We're invited so many places because we had that actual community event, that highly stressful event. We could even say that was a community trauma, where we noticed that this model helped us through. And the task force, again, strategically has been using this model to build that common language to help people understand. And we have a great community example. Um, and even though it was a hard time, we can still see the effects or the impact of Florence all around us on a regular basis. But it does give us that opportunity to recognize, and we learn this language from the model, what else is true. So we have gotten most of our partners trained in the community resiliency model. And that word spreads through the community through those leaders, those natural leaders, who take the model and the work of the task force into their spaces. So I make connections with people and tell them about what we do. But when we are doing our trainings, we've got many of our partners, like New Hanover County government, who start implementing it as their part of their onboarding. So they are
Okay.
constantly training new staff. Um, Harrelson Center, another example, partnering with us to support their partners. We've done some training in our school district.
Good.
Um, it's been
So
just great.
what
Mhm.
does the resiliency training involve? Let's share with everybody what are the components and what are
Sure.
the model and how does that translate to, is it the same for every organization, or do you look at like schools different than
Mhm.
communities or nonprofits or for-profit businesses?
hmm So we offer a few different trainings that really go back to the community resiliency model. So we'll start with the community resiliency model, as I mentioned before. It is a set of 6 wellness skills that are biologically based. So often we hear of resilience as kind of this abstract thing. It's you either are or you are not. But science really shows us that we can build resilient capacity just like we can build intellective capacity. Um, and so starting there, starting with our nervous system, um, is key because unless you run into someone who does not have a nervous system, which you won't, you'll be able to share these skills with them. And so this model, again, is designed to be shared in community. It's biologically based. It moves away from our perspectives of, people kind of pulling themselves up by their bootstraps just to do better, but actually equips people with the skills to do better and going back to kindness and compassion, a functional way to apply that lens. When I understand that when somebody comes to me, um, maybe combative or maybe displaying some behaviors that I find problematic, I can take a moment and realize maybe they're acting out of activation. Maybe
Mhm.
they don't feel safe. Maybe they have not acquired the skills yet to be able to manage the stress that they're experiencing. And so I can be aware of how I feel, which is great that this model does. We practice it on ourselves first. But then I can contour or adapt my approach based on what I'm recognizing. I can recognize that it's not just bad behavior. This person might be at a toxic level of stress that
Yeah.
have experienced their entire lives, or maybe they have not been able to acquire the skills to recognize signs of distress in the body, and they can't regulate their nervous system. So even with that mindset, it tells my nervous system I don't have to be threatened. There's something I can do about this.
Right.
So that's where we come from with this model. And that's really what that model is about, recognizing the signs of stress or wellness that our nervous system gives us and giving us the tools to be able to be our best selves when we notice any signs of distress.
Some people are always feeling stressed though.
Yes.
I mean,
Mhm.
so the model can help those people that are always,
Absolutely.
right? Okay.
Absolutely. And that's one thing that I think is um, great about this model is we can recognize that um, there can be factors that are out of our control
Right.
where we might be activated all the time, or we might be facing any number of challenges that can make life harder, but also make it harder for us to cope. And we recognize that that's okay. It's not, um, again, adversity is not destiny, but we can recognize that the hard things are hard, but we can also see what else is true. Alongside the hard things, we might have um, other support networks or community members or families or just some strengths within ourselves that we can go back to help provide that lens for us to be able to get through.
So how about those really struggling with mental health challenge?
hmm
How,
I
how
I go
good.
I'm sorry. I always go back to the fact that there are things that we can do for our own mental health hygiene. I call it mental health hygiene. And there are things that we can do for others. And that to me is that trauma-informed, resilience-focused approach. We hear about that a lot in healthcare, trauma-informed care, but a trauma-informed approach can be used anywhere. And for me, going back to compassion, this is the utility of compassion, right? This is the utility of kindness, being able to develop systems or procedures or the ways that we do things that intentionally are human-centered. I will often say we can sacrifice a little bit of efficiency, maybe even a lot of efficiency, if we're putting first things first. And first things are, do people feel safe?
Right.
Is what I'm offering, the services or my interaction with this person, am I trustworthy? Um, is the organization trustworthy? Um, are we transparent? Um, those are those kinds of questions we can ask because those things ultimately at their root are going to support mental health. And that's not abstract. We see that in literature, around education. That sense of belonging is something that people are starting to study more. But for me, just thinking about how our bodies respond to threats in our environment, when I feel safe, that might be the most mental health support that I need.
Right.
Um, when we think about Mental Health Awareness Month, especially during this time of the year, um, being able to go outside and stand in the sun can be so restorative. But if we're not paying attention to opportunities to maybe provide that for the people around us, or to do it for ourselves, then we are missing opportunities for that mental health hygiene. Thinking about it both ways, for ourselves and for others too, I think is so important. Um, that going back to just the individual managing their mental health. I mean, that's part of the story, but the full context is how are we building that within the community so we're not chipping away at people's wellness over time so that it creates that mental health struggle. It's very important for us to keep both perspectives.
So really, communication is critical.
Yes.
Stopping and listening to what's
Yeah.
going on, and a lot of times we go on whatever we're feeling, and sometimes we don't think about the other person.
Right.
And we have to this model helps you to back up, look at what's going on, and then say, how can I help that person or myself to be safe, secure,
Mhm.
and feel good about what we're doing so that
Mhm.
I can move forward, right? Is that what?
Absolutely. And, Anthony, I always go back to connection
Yeah.
being our first survival response. And when we think about being in survival mode. That's our nervous system not feeling safe and doing what it has to do to get through that moment, to face the threat or run away from the threat. Right. So, going back to that example I had of maybe someone being combative, maybe someone is shut down. Maybe it's hard for them to look me in the eye or to want to have a conversation. Maybe there's a little bit of avoidance.
Right.
If I'm seeking connection, what I'm actually signaling to that person's nervous system is that things can be okay. Things
Yeah.
can be safe, taking away a little bit of that threat, opening those lines for communication as they are able to communicate, not pressuring them, right, to share or to talk, but just creating the conditions conducive to them feeling safe so that those natural responses, when they feel safe or when they feel connected, can rise to the top. Um,
So what,
absolutely.
what so what tells you someone might need some other kinds of help? Someone might need some psychologist or
Mhm.
psychiatry help to help them through a situation. How do you identify it, and then how do you guide them to the is there part of their partners out there in the community?
Absolutely. We have several partners who are mental health providers, Coastal Horizons being one of those. They are across the state, but we're fortunate to have them headquartered here. We have a lot of other smaller mental health support providers too represented within the task force. But the goal for us as community members and as a task force is not at all to be clinicians or to diagnose, but to
Right.
help people understand that mental health struggles are not a weakness.
Right.
And there are lots of supports out there, and being able to take advantage of those supports and destigmatize seeking clinical care is what we work to do as well. Um, and I think when it comes to um, supporting help-seeking behaviors, having conversations like this
Hmm.
is so important.
Yeah.
So often people think that they have to struggle alone. But when they hear this language, and I think you mentioned it earlier, Casey and Anthony, that using, again, going back to the community resiliency model, I think our using that strategically has actually helped
Yeah.
across the county for people to build that lens and um, help reduce that stigma when it comes to mental health struggles and the importance of how we can be tuning forks for other people.
Hmm.
So we can recognize those signs of distress
Mhm.
and be that warm handoff for someone who needs support to the clinician or to maybe a human services organization that we know can help get that
Right.
person the care that they need.
Mhm.
And our lens becomes clearer to see that when we have that trauma-informed, resilience-focused perspective.
Which is so important. So the services you provide are so broad reaching and you can help so many people that are challenged, like even from mental health, ADHD, reducing the stigma of all these challenges that
Mhm.
families, children are going through to help them and help people understand it better. I mean, the best
Right.
is understand this and just take the time to listen to what's going on in someone's life so you can really understand how to help them best and then guide them to the sources that would help them.
Absolutely.
Be kind.
And be kind.
And be kind. Yes.
Yeah, so important. So on your website, and people can go to do this. There are a
Yes.
number of different types of training
Oh.
that are out there.
Hmm.
Can we run through those with the folks so in case they're
Sure.
in doing something like this, they can go and
Sure. So again, always lead with the community resiliency model. And that model is very adaptable. You asked earlier, does it depend on who's accessing it? And with the community resiliency model, because it's designed to be shared in community, we can adapt it for any audience that we're working with. We have used it with early childhood educators to build their resilience, and we know that they are part of those building blocks that help with child mental health, early mental health in children. The
yeah.
building blocks there, can really make it easier for a child to have that mental health later in life that we're looking for. So we've poured strategically into early childhood educators, partnering with Smart Start. Um, we can adapt it. We've adapted it to law enforcement and victim advocates. So again, I cannot say enough about the usefulness of the community resiliency model, no matter who we're trying to reach. And from the community resiliency model, we've developed an offering called Foundations of Resilience, which is a screening of the film Resilience, the Biology of Stress and the Science of Hope by KPJR Films. And an introduction to the community resiliency model. What we found is that people have a real aha moment when they see the themes of that film, which go back to adverse childhood experiences. Um, and one thing that I have pinged on too with that is those adverse childhood experiences and we say that socio-ecological perspective of adverse childhood experiences being those individual in-home experiences, but how does that ripple out to community experiences that are adverse? climate experiences and atrocious cultural experiences. So we do a little bit of discussion on that, and then we move into the community resiliency model introduction, which is just an overview of the model and the skills. Um,
Where can people find the biology of stress and the signs of hope? Where is that?
yes,
Where is that?
so I know that our New Hanover County Public Library has a copy of that for personal viewing. The task force, we screen that film often. We've partnered with Cameron Art Museum in the past to screen that film, and we do that upon request for organizations. Um, so that's one way to access it. And here in our community, or two ways, the library for personal viewing or a screening through the Resiliency Task Force. Um, and so we have that foundations, that combo. We've also in the past partnered with Resources for Resilience, which is an organization out in Asheville. They've developed a model called Reconnect for Resilience, which is foundationally the same brain science as
Mhm.
the community resiliency model, some very similar skills, but it's a more in-depth 2-day training.
So
Um,
how did Asheville come out with this? I mean, Asheville, North Carolina, how, did
It's
they?
this, going back to the same brain science and going upstream again to the community resiliency model. So
Did someone recognize it out there? That
yes, yeah, it's just
that's
it's so interesting how these are emerging,
yeah.
and how people are pulling from that same biological base and neuroscientific base, and the Reconnect I think is heavily influenced by the community resiliency model too, and they've moved into or expanded into that same base of science into historical trauma, intergenerational trauma, shame. It's a really powerful model, really great for individual community members to go through.
Well,
Um,
they had to use a resiliency model. Asheville did with all the storms that came through.
yes, yes. And
Challenge, man.
one thing that I do want to lift up is we've had teams from Wilmington who have been trained in the community resiliency model responding to the western part of the state for the last couple years since Helene,
Yeah.
um, who are, separate from a task force initiative per se, but represent organizations within the task force or trainers, community resiliency model trainers that were trained through the task force. So that is again how it just ripples out into the community.
Good.
Mhm. We also elevate trainings that our partners offer, Darkness to Light training, which is through Stewards of Children, through our local child advocacy network or child advocacy center, Carousel Center. They offer that, and that is child sexual abuse prevention training. Um, Coastal Horizons, our partner, they offer youth mental health first aid, which
Yeah.
is a really valuable model too. Um, and our partners now called Positive Childhood Alliance. They used to be Prevent Child Abuse North Carolina. Now they are Positive Childhood Alliance North Carolina. They offer that adverse childhood experiences training called Connections Matter that elevate how important the presence of a safe, stable adult can be in building childhood resilience. So there's another organization that we've partnered with to bring that training to the community. And then I also offer a PACES 101, which is based on some community information, some national data on adverse childhood experiences, and some background resources that we've acquired through the years with our partnership with Positive or PACES Connection, which is a global social network for resilience collaboratives.
So powerful. I mean, this is great. I hope people are listening because the information you're getting and the resources that are available here in North Carolina, and I don't know if any
Yes.
other states have it, but right now in North Carolina, some of the same things should be passed if they're not already out there throughout the other states that we have.
Mhm.
Because this is really does California have something like this? Because it seems like where
California
drivers
has
started, right? So
Yes, California has a really robust statewide network
okay,
around ACEs, and theirs is called ACEs Aware, and theirs is foundationally in healthcare, but it's trickled out across sectors there too. But what they are doing is really around screening for adverse childhood experiences, providing clinical and community supports for people who are vulnerable because of adverse childhood experiences. So there's another model, another state, and I believe New Jersey
okay,
actually has some integrated supports around building resilience throughout the state too.
yeah. I was just going to ask what other
Mhm.
states might be there. So
Mhm.
this is cool. All
Mhm.
right, so tell everybody how they can reach out to you. What's the pathway to get to the task force? And
Mhm.
if an organization or if an individual, what do I need to do? Just let it.
I would, yes, I would say please visit our website, which is nhcbouncesback.org. From our website, you can learn about the work that we've done and what we hope to do, our vision for the future. You can also read about those trainings that I mentioned and learn a little bit more with some reading resources that we have posted on our site as well. Um,
So do
you
you have a visual of the resiliency model on the website too, right? That people could see the breakdown. Is that
Yeah, well, our strategic model, our vision for the community. And so we've talked about how what we want to do is all of our partners have been pulling people out of the water very efficiently and effectively. But what the task force is this umbrella that brings all of us together
Mhm.
to find ways that we're not letting people fall into the water to begin with. So we have this visual of a bridge and our subcommittees that do the work around childhood, health, first responders and justice and community. We are filling those faults in the bridge to keep people from falling through. So that's the model that we work from. And the language, the way we're building that common language is through the community resiliency model. Mhm.
Who needs to get resiliency training?
Everyone,
everybody?
everyone, like, and I'll go back to that
Yeah.
half joke that I tell anyone who has a nervous system needs resiliency training. We have got to build that lens for ourselves, but we really have to be able to see our community and the way we do things as a community through this lens. Yes, we
So
all
how
need it.
so how do you know that you're reaching the population here
Mhm,
that so everybody should get some resiliency training, but
mhm,
how do you track that the stats you use? What tells you you're making
mhm.
progress? I guess from
Yes. So right now, what I would say is we are tracking outputs, and that's
okay.
who we're training and how many folks that we're training. We've trained about 8,500 folks in our community since 2018.
That's
Mhm.
great.
So and again, that's not me doing the trainings. I do trainings. I've
Mhm.
trained lots of folks, but it's our partners investing in their work in the task force by taking it into the spaces and the sectors that they are in. Um, our county government, Bo Dean, who is the senior HR analyst at New Hanover County, he has been a resilience champion of this from the beginning. And so he has worked to include it in their onboarding, as I mentioned before. So any county employee coming in is at least getting a 90-minute community resiliency model introduction. Coastal Horizons, another one of our strong partners, they have many folks on staff now, and they continue to make investment in getting community resiliency model teachers trained within their organization to do internal resilience support and to provide that for the community. And Amy Reed and Kelly Purcell are great leaders in that in Coastal Horizons. Harrelson Center, another example of bringing the community resiliency model, Christy Ailey, another community resiliency model teacher, leveraging it in her space and in her organization with the support of Mead Van Pelt. So those are just a few examples of how this works, how we export it. It's our community partners taking ownership and using it to support the work that they're already doing.
Great.
I can say that before we have started your program, at
Mhm.
least I guess it never really dawned on me that, we are trying to help so many people with very difficult, challenging
Mhm.
situations. And just because we've been through one of those ourselves does not mean that we, know how
Mhm.
to talk to people or help people, that are going through similar
Mhm.
situations. So it really did I can't think of the word I want to
Yeah.
use.
Yeah.
It
Help.
enforced to me, yeah,
Yeah.
that enforced to me the urgency of us keeping our cups full
Yes.
so that
Yes.
we can pour into others during their
Absolutely.
difficult situations. And
Yeah.
I mean, I knew that we wanted to help people, but I just never really thought about that piece of it. And that
Mhm.
has been very, very helpful.
Because a lot of
Oh,
people,
that's so good to hear. Absolutely.
a lot of people that we deal with feel they're all alone, and that's part of the challenge. Like, I feel like I'm on my own little island. No, well, you're not
Oh,
alone.
yeah.
There's a lot of
Mhm.
people going through the same challenges, or, some families that have children that just are, don't can't understand, can't have learning challenges. We
Mhm.
gotta help them to get the help they need to be able to
Mhm.
learn. And everybody can be helped, right? I mean, I said most people can be helped. You know,
Yeah.
we have to turn that around and make them want to get help too. So
Yes.
Mhm.
so
Yes.
a big part of this is understanding that talk that we need to do, and we need to give the positivity to the family.
Mhm.
I mean, that's
Mhm.
so in this whole scheme, you've mentioned kindness a number of times, and we're all about kindness. So talk about kindness. How does kindness fit through the whole resiliency model and the training and everything that you do? Because we feel it when we're with you. We
Mhm.
feel your kindness
Oh.
we do it. And so just share it with what why is it so important?
Yes, I mean, and I'm so grateful that you said that, Anthony. Thank you, because that is authentic.
Mhm.
I think that kindness is really what our nervous systems want. And again, we're going to go back to the biology. Oftentimes, when we hear about kindness, people consider it to be this abstract, um,
Yeah.
simply emotional experience. But what kindness does in our nervous system is that it allows us to take a deeper breath. It turns on the part of our nervous system. If we were to think about our autonomic nervous system as two parts, the gas for when we have to respond to threats in our environment, and the brakes for when it's time to rest after that threat. When we feel kindness, it is allowing our bodies to let up off of that gas pedal. Okay. Kindness helps us apply the brake so that our bodies can heal. When we're activated all the time, that's when we get to that level of toxic stress. That when we
Mhm.
talk about that, it's not just, oh, it's just, I'm just so stressed out. Toxic stress is when there's no buffer.
Yeah.
And parents, caregivers, children who have diverse needs, who might be neurodivergent or medically fragile,
Mhm.
or might have other diverse needs that typical families might not deal with. Typical families have a level of stress already. But think about all those typical things that we might have to deal with, and then layer on medical fragility, neurodiversity,
Exactly.
feeling isolated
Yeah.
because maybe most of the people in your orbit are not having to manage the stressors that you have to manage. When there is no buffer for that, it gets to a toxic level of stress. Okay, so kindness, and I've talked about joy too as being an important component for this. And there's lots of research emerging around kindness and joy and compassion. Um, but it really does signal to our nervous systems that we belong and that we're safe. That's what we're searching for, that connection. That's our first survival response. And when we exhibit kindness, and you can't fake kindness as something that I mean, you can be nice,
Yeah.
but our nervous system can discern when true kindness is coming through. And
Mhm.
when we notice that, our nervous system changes to turning up our relaxation response, where our bodies can heal, where, all the cortisol and adrenaline that we have to respond when we don't feel safe, actually wears on every system of our body. And so when people are kind, you are actually giving that opportunity for healing in the body. And that's not abstract. You can measure that
Mhm.
in the body. So that's
What
why kindness is important, and to be able to um, recognize my activation and do something about it gives me more opportunity to share my kindness as opposed to my activation, right? As opposed to my own survival or defensive mechanisms.
you
Yeah.
know, we really didn't. There is such a there's a subtle difference between being nice and
Yeah.
being kind. You
Yeah.
said it too. So we
Mhm.
didn't until we got into doing what we're doing and set up Andy's Way to Road to Kindness. We really didn't think about it like that.
Mm-mm.
And there's a subtle difference, but it really, when you're kind, you feel it.
Hmm.
Really, you can get someone to feel when you do a kind act. You really feel, and when you help them through a situation. I mean,
Hmm.
and it's just some of it's just taking time and
Exactly.
like
Exactly.
help
And
people. Okay.
Anthony, I remember you saying just being a listening ear.
Yes.
Um, I mean, that's one of the kindest things you can do. And just it develops a connection to a point where, and this is my experience. I don't want to make this assumption for others who might be parents or caregivers of children or adult children who have needs.
Mhm.
But sometimes people think that offering you suggestions or have you tried this or have you done this or all you have to do is this. That does not necessarily feel kind, even though it comes from a kind place. But that
Right.
listening ear,
Yeah.
that feels in my nervous system like kindness. I know that there's a million things that I've already thought about in my situation. And the suggestions don't make me feel connected. They make me feel like, oh, what am I missing? Or I've done everything you've said I've already done,
That's
Yeah.
right? But
Yeah.
just the listening ear, that helps me feel more connected. It helps me feel safer. I mean, physiologically, even now in this moment, I'm thinking about it and just being able to take a deep breath,
Yeah.
that shows regulation. That shows my body getting to a place where I can think clearly, where I can make my best choices, where I'm healing from the inside. So
Yeah.
and I remember you saying that, and that landed with me, and I wanted to make sure that I brought that up. That listening ear is so
So,
important.
so I grew up in a for-profit business, so I had to always, come up with solutions and
Yes.
solve problems and find the answers and all this other stuff. And so what really changed as we built this nonprofit now is we're listening more.
mm-hmm.
We're
Mm,
sharing, we're
mhm.
listening first,
Yes.
figuring out what might be the helpful pathways for families. And that's a big difference because when you're buying and selling companies or you're doing all those things out in the real world and you're just figuring it all out, you gotta be solution driven. You gotta
Yes.
what do the numbers tell you? You're looking out here, we're just saying, let's take a step back and let's really look at the situation you're in. Use kindness to help figure out what the pathways might help. And sometimes it's just families just want to know they're not struggling by themselves.
Alone. Yeah.
Yeah,
Yeah,
they're not
exactly.
alone. I mean, this is something that, and the challenge that we run into, and maybe we could help our audience listening to this, is that people still don't view ADHD as a social challenge, a big social
Right.
dilemma yet. And, there's a stigma around it. And we work with some wonderful little kids. I mean, there's 100 families, the little kids that we've tied in here and connect with, really brings us a lot of joy.
Mm-hmm.
Yeah.
Um,
And that helps us move
that
forward.
helps us move forward
Yes.
too, because
Yes.
but, you know, when a little boy says, I don't want to have ADHD, because they're being bullied or someone said something about it or they've got this bad view of it. How help people understand that, how can they, you said destigmatize mental health before. We still have to destigmatize this ADHD realm here,
Yes. Yes.
and a lot of other places like autism has figured out how to do that, but in ADHD we haven't figured that out yet.
Hmm.
And
Hmm.
we're trying hard because we want to change the landscape for
Yeah.
this thing.
Hmm.
That's part of our whole vision is change the landscape, change the view, help these kids to understand, hey, they're made in God's eyes, are made perfect. Let's help them to find, let's help them and
Hmm.
to feel good about themselves. You know,
Hmm.
uh,
Yes.
help people understand.
Yes. So I'm going to put on my lived experience hat.
Yes, please.
This is not coming from the research. This is coming from my lived experience serving children as a paraeducator in special education
Hmm.
and as a mother of a child that has some neurodivergence and medical fragility. A lot of what we encounter in helping our children through is not because of our children, it's because of the world around them and the systems around them.
Yeah.
And so being able to help them recognize that yes, we have struggles, but let's look at this. Maybe sitting and attending in a classroom is something every child struggles with, but it might be more of a struggle for you because that classroom's not designed for you, not
Right.
because you're not designed for the classroom.
Right.
You're not going to be in a classroom your whole life. And this
Right.
can't be your defining moment of how you feel in spaces with other people. Um, and I've tried to make sure that my students have known that and that my child knows that
Hmm.
going back to that strength-based mindset, um, that gift-based mindset, yes, there are struggles, but you are not defined by the structure of this space. And I know that that's what sits a lot for parents and caregivers is trying to equip
Right.
their child to be able to manage everywhere they have to be, but also going back to our strengths, we have to help them recognize, well, when we're not in that space that might be activating or actually exacerbating some of those symptoms, um, how do you show up that you love about yourself? What do you recognize? We also have to consider there are many adults our age um, who have not been diagnosed.
Absolutely.
And,
Yeah.
so what are the things that help them through? And they're at this point where they are living life, they have careers, or what are some of the challenges for people who have not been able to integrate as easily
Mhm.
into mainstream jobs or mainstream family life that we
Hmm.
can say? What are some of those struggles that we can look at and say, together we can create a solution, you and me?
Yeah.
Um, and again, this is me wearing my parent and
Beautiful.
special education advocate hat, but
Yeah.
I think those are really important questions, the strengths-based questions, and
Yeah.
questioning more the system and the environment as opposed to that individual, because we should be contouring and designing universal places for people to be able to learn and live life and do what they need to do instead
Amen.
of being
Yeah.
so deeply cemented in, oh, well, most people can do it, so why can't you? Or most people can do it in this environment, then that's the efficiency that we need to aim for. And it's just not the case. It just
No,
really isn't.
It's not.
no,
So,
it's not.
and so what we look for is the passions on, like, if a child's good at playing lacrosse,
Yes.
let's focus in. That's great. You're wonderful at playing this game or playing soccer, whatever it might be, or you're good at martial arts, or let's hone in on that. There's so many
Hmm.
things you're learning there that can translate in the up to your other learnings. And we want you to find your passion, focus on that, and then there's people here who can help with the learning side, the math side, or the
Yes.
the writing side, which a lot of kids that have ADHD, Anthony couldn't write. I mean, he had this
Yes.
he had dysgraphia too, which was a big challenge. So a lot of kids have other things that are going on, and um, they're all workable, and it's just finding the right way to help them. But it's
The
stuff
right way and the right pace,
that's
just
the
being
right
mindful for the
way.
pace. And their pace is okay. As long as there's constant support, then
That's
their
right.
pace is okay.
Yeah,
But
that's right.
the support is I think what is the hardest thing for parents
Yeah.
getting
Yeah.
support. and finding people that understand what their child is actually going through, because a lot of people don't understand. Kids don't want to be bad. They don't like
No,
to misbehave. They don't like getting
exactly.
in trouble all the time.
Yeah,
So if you understand that, you can come at it from a much kinder place, than
exactly.
thinking, well, why are you bad? Why are you so bad?
Yeah.
Your special education experience has done wonders for what you're doing today.
Mhm.
Yes.
And
Yes.
no, so how can I think you mentioned somewhere along the schools are involved in this. How can schools really get the perspective and teachers get their teachers trained to get the perspective that not every child's the same. I mean there's a lot of kids, there's lots of kids in these classes, and
Hmm.
understand that it's challenging for them to
Hmm.
say you have a 504 on this piece, you have a 504
Right.
on this. Every 504 is different. They're not all the same.
Hmm.
Even kids at high
Exactly.
school.
Hmm.
So what guidance can you give being
Hmm.
your experience and with what you're doing today, what you've
Hmm.
done before, say, hey, teachers, how can we really we want to back up a little bit and say how can
Yeah.
we
Do
do
you,
differently?
do you work with schools?
Yes, yes. We have done trainings with individual school sites. Um, and, again, from my past experiences, I think we have got to invest in teacher resilience. I think that is so
Definitely,
important.
definitely.
We continue to ask educators to do more with less and less and less. And
Yeah,
that it creates provider, what I would say is provider stress. And
yep.
it's very hard to see um, certain levels of differentiation, um, when you are so stretched.
Yeah.
Um,
Absolutely.
and so always go back to addressing that, addressing teacher resilience, making sure they have the support staff that they need, paraeducators, mental health therapists in every school. Um, Lots of parental support, building that community, volunteers have in the school is a big deal too, to help
Yeah.
support some of that.
Hmm.
It can be challenging, but there are many ways that if we would support educators, then those other things would fall into place. Community resiliency model training, again, I've said it often, it's life-changing. It really is.
Yeah.
As I mentioned before, it gave language to things that I was observing. And I'm a fan of action research, and that's just having a systematic way of recording your observations and changing what you're doing based on what you've observed. And I think equipping schools with that opportunity to develop that language using the community resiliency model, and then observing, well, what do I notice when I help regulate myself?
Hmm.
And I become a tuning fork for my students. When I recognize that maybe this behavior, my student happens to have ADHD, but what is this behavior an indicator of?
Right.
And what can I do differently
Right.
that helps support that information that I'm getting?
Hmm.
It's not and I think a lot of teachers don't necessarily think this, but I know conventional wisdom might say, well, that bad behavior, but what came before that? Is there something that I can change? Is it the way we transition
Yeah.
into the classroom? But just giving educators room to be able to process that because they have all the other supports in place can be
Right.
so important and change the trajectory of a lot of individual students'
Oh yeah.
experience at school if they had that. Teacher support if teachers were really supported in that way.
Yeah. And we would hopefully retain more of our teachers because they're
Yes,
leaving in
absolutely.
droves because they're just so frustrated with the way that
Yeah,
they're going.
yeah,
So yes,
yeah,
hopefully we could retain, the good teacher.
yeah, yeah. And then again, we all using that language, that strengths-based language, and now thinking back on years before I knew better, as a parent, just saying, okay, well, how can we, um, in the IEP meeting, in the 504 meeting, just using that language. Well, my child can do this, this, and this. Is there something um, in her environment or in the schedule for the school day that actually is keeping her from being her best self? Those things we can fix.
Yeah.
And she's got to be able to feel as included and belong as much as any typical student in the classroom. So we can use that language as parents too.
Yeah.
Um,
Anthony's elementary school got a lot of support from me because I volunteered all day
yeah,
long.
yeah,
Just
yeah,
I could be there, as we were
yes,
learning about, his ADHD and things, just so if something popped up, I could be there,
yeah,
to assist.
She did
So
yes,
great. She was wonderful with all the kids. I mean, and
I'm
always
sure.
being the parent helping the teacher. You were
I was
great. I would,
the head of the parent
you know,
teacher organization. So
parents
Hmm.
don't always have that opportunity. We were able to.
Right.
She was able to stay home with
I
the
was
kids, and that so
thankfully I was
yeah,
able to do
that's
that.
great. If we have more
And I know
parents staying,
everybody doesn't have that
yeah, if
opportunity.
there are parents that have that opportunity, please volunteer.
Yeah.
You're going to be so helpful in the classroom, and it's going to be.
Absolutely. And parents who might not have that lived experience, who might not have the student at school with ADHD or any other sort of neurodiversity, if you are a friend of a family, be the one. There are lots of ways we as community can come around each other that reduces parental and caregiver stress. Even though we might not fully understand the diagnosis, we can still be some support in those spaces.
So we covered a lot. So is there anything that you want to share that we might have missed
I
with?
think we covered so much, but going back to your mission and why you all exist, I just want to thank you for what you're doing in the community, because you are building community resilience. You are serving folks who, as you said, feel isolated. So the work that you do is so important, and I'm glad that you take care of yourselves, so that you can take care of others as well.
We do have to take care of ourselves, and that's why we
Yes.
go. That's why we
That's
haven't
why we're
missed
so
we
thankful we
haven't missed
met
a
you.
class that you've
Yeah,
done.
Yeah.
So we
absolutely.
and we've been at all your sessions, whether they've been
Yes.
online, and we value
Yes.
what you do bring to the Harrelson Center and to the community.
So
So
much.
so thank
Thank you. Thank
you.
you.
Listen, we're at the end of our podcast, and I hope you enjoyed today's episode with J'vanete Skiba. She's just wonderful, wonderful information. Please take time to listen, and embrace the information that was shared today. And specifically, this is for New Hanover County, so a lot of people in New Hanover County. But if your community doesn't have this, reach out to people. Try to set something up like the task force, and
Mhm.
because it can only help your
Mhm.
communities.
And I'm happy to be a listening board for that. Yeah.
I was happy to hear that, Los Angeles, because of what you talked about, New Jersey too. I mean, some of the
Mhm.
states, some of these big states that they need some of this help.
Yeah.
Um,
Yeah.
and so, we're really excited. And if you found today's episode helpful, please share it with someone who might need it. Your organization, a parent, a teacher, anyone walking the ADHD journey or any of the mental health challenges that we've talked about today. Um, Everybody's there to help, and we want everybody to stop, take your time and listen. Those are the key points. And the more we spread this information, the more support we bring to those wonderful kids and their parents and anyone working to help those with ADHD. So to learn more about Anthony's Way to Road to Kindness and our mission to empower children and teens, visit us online and follow along on our social media. And also please subscribe to our channel, so you don't miss an important podcast like this one. I mean, these are so important. We try to do one every week, get the information to you. So, and now we want to bring something that's so exciting. We're excited to share that this month in May, we'll be soft launching a major fundraising campaign called 1 Million Orange Hearts of Kindness campaign. And with our icon being an orange heart, it stands for unity and togetherness. And we created a virtual orange heart of kindness now. You can become part of our kindness movement and can help support our mission by purchasing an orange heart of kindness for just $5. Just $5. Forget the Starbucks today. Just pay $5, and with every heart purchased, You can write a kind comment on it. You can buy an orange heart for someone special. You can offer it up for someone. You can make it visible on your social media. We've built an app that you can do so much with, and we believe that this can become a national movement, and we want it to become a national movement because if we raise $1 million through 1 million orange hearts, we do 1 million orange hearts for $5. That's $5 million to help so many kids. Could help hundreds and hundreds of kids with ADHD and their families. So please go to hearts.anthonysroadtokindness.com. I'll say it again, hearts.anthonysroadtokindness.com. Your support helps us to continue making a difference in the lives of kids with ADHD, and we thank you so much for your support. It's an investment in helping children. And as we like to wrap up with our favorite saying, today is the best day of your life,
and tomorrow
will be even better, and life is better with you. Please post it. Say it every day. If your child's having a challenge, Anthony used to run out of the house saying, "Today, Dad, today's the best day of my life. Tomorrow's going to be
yelling it
at us." So, please share it. And life is better with you. We want everybody to know life is better with you.
You're valuable.
You're valuable. Thank you so much for listening. J'vanete, thank you again for joining us. We had a great time with you.
Thank you so much for having me. Thank you.
All the best, everybody.